There's new data showing the financial cost of COVID-19 hospital stays. You might be surprised by what the numbers reveal. The CBC's Hilary Johnstone has the details.
For the past 19 months or so, we've been keeping an eye on those hospitalization numbers, and now we have idea of just how much it costs. So according to the Canadian Institute for Health Information, the average COVID-19 hospitalization costs about $23,000. That is 4 times more expensive than what it costs to hospitalize someone who has the flu, for example, and it's 3 times more expensive than what it costs to hospitalize someone who has had a heart attack, for example, and it's nearly as expensive as what it costs to hospitalize someone who is having a kidney transplant, which, as you can imagine, is quite a complicated procedure. And what the Institute says is that a big reason why it costs so much to hospitalize someone with COVID is because of the length of time that they're spending in hospital.
COVID-19 patient is often in the hospital a lot longer than some of the conditions like influenza or pneumonia. So an average length of stay for a COVID-19 patient in hospital is 15 days. If they are in the ICU, that actually adds another week onto it. On the average, they're there for at least 3 weeks.
The report found that from 2020 to 2021, COVID hospitalizations in Canada cost more than $1 billion. Now, when you compare that to other OECD countries, Canada is actually spending less per capita when it comes to COVID hospitalizations than a number of other wealthy countries, just to sort of put those numbers in perspective, but they are still large numbers. But according to some doctors who we've spoken with, they're not surprised to see just how much it costs. They say that the medication that's used to treat COVID-19, the supplies, that all of that adds up to quite a large dollar figure.
A heart attack patient will come into the hospital, get some aspirin, which is really cheap, get some other blood thinners, get a cardiac stent, and go home probably the next day. A lot of patients that get COVID use a lot of resources. They become ICU patients. They use more expensive drugs that we use to treat COVID. And they take a lot of resources to treat these patients in a long period of time.
Dr. Spiegelman also says that a lot of those COVID-19 hospitalizations are avoidable. He says that of 10 people right now that they're treating at his hospital that are on life support with COVID-19, that none of them are vaccinated. Hilary Johnstone, CBC News, Toronto.